Hello, my name is Brandy Boland, and I am doing my um, advanced health assessment head to toe exam for Maryville University. And this is my subject. This is my son, and he will be my subject for the head to toe video. Before we got started, I asked that he empty his bladder and change into a gown. We do not have a gown, so he is in appropriate alternate attire. We also obtained a set of vital signs, his height, his weight, and also did his eyesight assessment on the Snellen chart for near and far-sighted vision. He does wear contacts, and he saw 20/20 with correction. We're going to start with a general inspection of him. We're going to look at his head, his face, chest. His head is normal cephalic, no bumps, no lesions, no obvious trauma. The head is round and symmetrical, no dents, no signs of any sort of trauma at present. His hair is cut. It is dark brown, even in appearance, no alopecia, evenly distributed. His face is symmetrical. His eyes are level with his ears, so there's no deviation. His eyebrows extend laterally to the temporal region. Nose is midline, no deviations. Septum appears to be straight. His lips are pink, moist, without any cracks or lesions on them at present. There is some acne noted for his age. His skin, other than that, there are a few small scars and lesions from previous traumatic injuries. No obvious open areas or wounds at present. His skin is pink, warm, moist. On inspection, his arms are warm, no signs of trauma. His nail beds are pink and moist. His capillary refill is less than 2 seconds. There's no signs of any actual trauma to the arms. They move symmetrically. We're looking at his face and his head, and we'll start with the actual palpation of his head, and we're feeling for any signs of tenderness or trauma, any nodules or lesions, and none are felt. His head, his scalp moves freely, which is normal. Is there any tenderness noted? No. So we're also paying attention to his hair. It is fine. It's not coarse. Well distributed. We're also looking for any sort of parasites that might be present, and that's negative. We would then move to his eyes, and they're even. Again, his eyebrows extend laterally without any deviations from them. His eyelashes extend out and up. There is no turning in, nothing abnormal. I'm going to have you close your eyes. Is there any tenderness?
No.
Noted? None to the lacrimal area?
No.
Okay. And then we would also palpate the sinuses. Is there any tenderness to the sinus area?
No.
Facial bones?
No.
No tenderness to the facial bones?
No.
Okay. And then we would have him open and close, noting any clicking of the mandibular joint, and there was none present. Everything looks normal on that. On his eyes, we are going to look for the red reflex, and that is present. And then we would also look at the optic disc, making sure that it is round without any lesions or abrasions noted. that his sclera and conjunctiva is appropriate, that we don't have any deviations on it, that there's that his pupils are nice and symmetrical in size. We're also going to look at his eyes, and we're going to do direct and indirect, and that they're round, equal to light accommodation, that there's no deviations noted whenever you do it, that whenever he opens his eyes and everything, that nothing, there's no dryness, there's no exudate, that he can focus, no nystagmus. Can you look at the wall? Can you see the picture on the wall clearly?
Yes.
Can you see the writing on the stethoscope clearly?
Yes.
Okay. So his far and near sight are intact, and we're going to do the cover and uncover test. I'm going to have you cover your right eye, look at the point on the wall, and then move your hand, and then cover your left eye, and uncover. And we're noting that there's no nystagmus or any extraocular movements whenever he does this. We're going to check his cardinal fields of gaze, and I'm going to have you look straight forward at me, and I'm going to have you follow this object while keeping your head still. Okay? And when we do this, we're checking for any extraocular movement, and that is all intact without any deviations. So he has good cardinal fields, and that lets us know that the nerves are intact. We would move from that to his ears, looking at them, making sure that the auricles are even, symmetric, no exterior redness, edema, deviations. Then we would palpate them. Is there any tenderness?
No.
What about whenever gently pulled?
No.
No tenderness with the pull reflex. Then we would check his ears, looking in them, and the ear has some cerumen, but it appears a light grayish white, with no redness, no edema, no infection noted at present. We're going to pull out and up, and again, same thing on this ear, a light gray in appearance, no deviations, a little bit of cerumen present in that. And we're going to do his hearing test. We are going to have you to turn, and I'm going to have you to occlude your right ear, and I'm going to have you repeat the word that I say to you in a whisper, the whisper test. Apple. And then I'm going to have you occlude the other ear. Orange. And so the whisper test was intact. And you can turn back around. So his hearing is intact. We're going to do one more thing on his eye exam. I'm going to ask you to tell me when you can see my hand.
No.
And again, when you can see my hand.
No.
So his peripheral vision is intact. We will then perform the Weber's test with the tuning fork. Would you tell me if you hear it in one ear or both ears? And which ear you hear it in?
Both.
Okay. And then we're going to do the Renna test. I'm going to place it behind your ear. Let me know when the sound stops, and then let me know when you hear it again.
Stopped. I hear it. Stopped. I hear it.
Okay. and we're checking that the bone conductivity is less than the air conductivity around the ear, and that's well and intact. And then we would look at his move from there to his neck. His throat appears warm, dry, no lesions, no deviations. That his trachea is midline, again, midline here, from front to back, no deviations. That it does move easily when touching it and palpating it. Where we are looking to make sure that everything is symmetrical. We're going to look at his mouth. We're going to look at his lips, that they are pink, moist, that they're intact. There's no deviations from it. We're going to have him to open his mouth, and we're going to inspect the inside of his mouth. His tongue is pink and moist. While you're doing this, you're going to have him raise his tongue and look for any lesions or cancers on the underside of the tongue. I'm going to have you say ah. You're checking that the uvula moves freely up and down, and you're also looking at the tonsils to make sure that there's no swelling or edema noted to them. And they're not. They're just +1. They're not touching. There's no problems with that. You're going to inspect the hard and soft palate, and those are intact. Looking at the teeth, counting the number, the color, if there's any dental caries that need to be reported. Making sure that everything is grossly intact. No problems to look at. No lesions noted on the tongue, underside, or anything like that. Then we would take the tongue depressor and go and checking the gag reflex, and that is intact. So everything is good with that. On his throat, it's midline. There's no deviations, no lesions that I've seen. We would then palpate it, noting the carotid pulses, and those are intact. There's no tenderness. Any tenderness noted?
No.
None posteriorly or anteriorly. I would have him turn, and I'm going to palpate the thyroid, and I would have him to swallow. And there was no nodules or lesions felt on palpation of that. So go ahead and turn back around. And while we're here, we would move up to the lymph nodes around the face. We will start with the preauricular, moving to the postauricular behind the ear, to the occipital, to the posterior of the neck, to the submental and the tonsillar, and then down the submentular chain to the deep cervical and the supraclavicular. And there are no lesions, swelling, or anything noted at this time with those, and no tenderness. Then we would look at the chest, making sure that it's even, symmetrical, no scars or lesions noted. Making sure that the chest rise and fall has equal excursion, not deviated to one side or the other, that the diaphragmatic excursion is equal. And then we would palpate for any tenderness to the chest. Any tenderness noted? No. And while we're here, we will get the axillary lymph nodes. You need the tenderness noted there?
No.
And then I would have you say 99.
99. 99. 99. 99. 99. 99.
And the tactile formicus is intact and can be lightly palpated. From there, we would listen for our pulses, and we're going to start with the carotid, with the bell of the stethoscope. Listen for any brewing. And then go to the thyroid, and that is negative. And then we would start in the right second intercostal space for the aortic, left second intercostal space for the pulmonic, moving down to the tricuspid, moving over for Erb's point, and then mitral, and PMI, fifth intercostal space, mid-clavicular line. While we were palpating earlier, we would feel for any heaves or thrills, and at the PMI. And that's all normal. Then we would percuss his lung fields, noting any dullness. Or resonance noted. That would indicate fluid or exudate within the lung fields. Making sure to extend laterally for the bases. And there was no dullness or resonance heard upon that. Okay? And then we would listen anteriorly for the lung fields, moving back and forth. And as you listen, make sure to extend laterally. Check all lung fields. That there's no adventitious lung sounds such as wheezes, crackles, and those all sound good. We would then have him turn for the posterior. And we would check his back and chest, posterior chest area, making sure that there are no lesions, no scarring, no wounds that we need to see. Then we would palpate. Is there any tenderness?
No.
And again, having you say 99.
99, 99, 99, 99, 99, 99, 99, 99.
And the tactile flucus is intact posteriorly. And when we would do this, then we would listen bilaterally posterior for any adventitious lung sounds. Making sure to note and making sure to extend laterally, checking the lung fields. And you would percuss the areas, noting any resonance or dullness that you would see or feel in any of these areas. And extending laterally to make sure and get the bases of the lungs. And there was no dullness or resonance noted at present to any of the lung fields. Go ahead and turn it back around. And at this time, if we could put him at a 45, we would look for a jugular vein distension in the reclining area. So, and at this point, he would not have any due to his age, more than likely. Then we would move on to examining the abdomen. Go ahead and lay back. And raise your shirt. And we would take the light and make sure that to inspect the abdomen, noting whether there was any herniated areas, that everything was even and symmetrical, that there was no deviations, nothing was noted at present. Making sure of the muscle tone and the skin, and making sure that everything was equal, no deviations to the lower inguinal area, and then we would palpate the abdomen. Actually, first we would auscultate and then palpate. So you would take your stethoscope and listen, starting with the right lower quadrant, listening for vowel sounds, noting any adventitious sounds, no mechanical clicks or tinkling, and those all sound good. Then we would take the bell of the stethoscope and listen midline for the aortic, and then moving down for the renal artery, moving bilaterally to the iliac, and then on down to the femoral. And those are all intact. And then palpating the abdomen lightly, noting any lesions, tenderness, and seeing if you can feel any a little bit deeper or any sort of boundaries, and no extra tenderness. And then we would percuss, looking for the liver borders. We move down and note the borders on the liver, and 3 to 5 centimeters on him is normal on the right quad for his liver borders. And then we would percuss on the left side for the splenic borders. And I'm going to have you turn up on your side. It's easier to percuss and get good areas for the splenic. And you should not be able to palpate the spleen. If you do, that's something to be noted and reported. And the borders on it should be intact, about 2 to 3 centimeters. Go ahead and fold back over. And so we have good borders on both the right and the left, splenic and liver borders. Then we would palpate more deeply to see if we can get the rest of the organ borders. And you should not be able to palpate the kidneys. And you can go ahead and sit up. Then we would look at his lower extremities, making sure to note the presence of hair distribution, that they're warm, they're dry, no edema, no discolorations noted, no scaliness to the skin, we're going to palpate his pulses at the popliteal, the tibial, posterior tibial, and dorsalis pedis on both sides, and they're all good. And at this time, we would note that the capillary refill to the toes, and that toe inspection, capillary refill again is less than 2 seconds. All of his extremities look warm, dry, intact. We're going to check gross motor function. So I'm going to start with cervical. I'm going to have you lean your head all the way back, all the way chin to chest, to side, and then I'm going to have you push against my hand, and push against my other hand, and then I'm going to have you shrug your shoulders. Can you put your shoulders to your ears? And then I'm going to have you to do some gross motor functions for the cranial nerves. I'm going to have you to wrinkle your forehead, and then I'm going to have you to squeeze your eyes closed. Alright, and I'm going to have you to smile really big. I'm going to have you to show your teeth, clench your teeth. Then I'm going to have you stick out your tongue, like midline. Okay, and that seems to all be intact. And then I'm going to have you to puff your cheeks. Okay. Every one of those are in order, and they all seem to be intact. At this time, I would also want to look at his nose. Earlier, we did not look at his nose. It is midline. There's no deviations. I'm going to look up his nose for hair distribution and any sort of deviations to the septum, any swelling or exudate, that the turbinates are not red or inflamed, that there's no excess swelling or edema. We've got everything all intact. He has had a previous nasal surgery, so there's no deviations to that. On the other motor functions, we're going to go back to the arms. I'm going to have you put your arms out. Okay, don't let me push them down. Okay, flip them over. Don't let me pull them up. Okay, that's good. Again with the legs, don't let me push them down. Don't let me pull them up. Now, arms out. Don't let me push them in. Don't let me pull them apart. And those are good and intact. And the legs, don't let me push them down on the feet. Don't let me pull them up. And all 4 extremities are equal and without any sort of deviations to them. On all of his motor nerves and everything, they all seem to be intact. I'm going to test the touch on his face. I'm going to have you close your eyes and tell me if this is equal.
Equal. Equal. Equal.
And so the touch on the forehead, cheeks, and chin are all equal and intact. I'm going to have you to extend your arms out slightly, and we're going to check your reflexes. And I'm going to check his reflexes with the hammer. First, brachial and radial. And they seem to be intact. And then I would check his on his knees and on his Achilles. And they're all intact. His pulses are noted in brachial and radial, both bilaterally. Those are good and intact. His arms and legs both seem to have equal muscle strength. I'm going to have him stand. and I'm going to have you turn, and I'm going to have you lean straight forward just a little bit. Is there any tenderness noted
No.
to the back area, lumbar
No.
spine?
No.
Okay. And there's no scoliosis or kyphosis noted. I'm going to have you turn around, and I'm going to have you to stick your arms out to your sides. Close your eyes. And again, we're checking motor nerve function. I'm going to have you open your eyes, put your arms down to your side, legs together, and I'll have you close your eyes again. Again, checking nerves, making sure that everything's intact, that there's no deviations which would cause him to lose his balance with his eyes closed. And all of that seems to be grossly intact. So I'm going to conclude my video. I want to thank my son for being my subject, and this is Brandy Bolin for Maryville University head-to-toe assessment video. Thank you.